Hello, I'm Dr. Marla Shapiro. I'm a professor in the Department of Family and Community Medicine at the University of Toronto, and I sit on the Board of Trustees of the North American Menopause Society. Today we're joined by Dr. Lisa Larkin, well known to many of us at NAMS. She's president of Lisa Larkin, MD, and associate and director of Women's Corporate Health at TriHealth in Cincinnati, Ohio, and she's an internist. So, immunization in adults, we tend to do such a poor job, and at midlife even more so. So why are we not doing a good job, firstly?
So immunizations are something that is so important for midlife women's health. And as a primary care provider, this is something that I'm very passionate about. And we know that immunizations are something that really gets forgotten about, and that the vaccination rate for midlife women is really lower than we would like. There's many barriers to this. Really, it's time of office visits. It's really a focus these days on disease management as opposed to disease prevention. Mm-hmm. And so really one of the key things for women's health providers is to focus on disease prevention, and immunizations is really key to that.
So let's focus on that. I mean, a lot of our patients will come in looking for travel vaccines if they're traveling. So we'll put that aside and we'll remind people about the importance of updating tetanus. But what else is there in and around midlife that, unless we move that agenda forward, our patients may not even know about?
Right, so certainly, this is the fall now, so annual immunization for influenza is really critically important. And there's clear evidence that healthy women are under-immunized for influenza. But the new vaccine guidelines have really changed a little bit, and one of the things that's clearly being missed is new recommendations for the new pneumococcal vaccine. So there's now, the vaccine recommendations have become a little bit more complicated about that with the new vaccine.
So two different pneumonia vaccines on the market. One is a polysaccharide, one is a conjugated.
Correct.
For physicians trying to understand, do they need to offer both?
Right, so absolutely the recommendations now are to offer both. And it's a little bit complicated because if you've been in practice for a long time as a primary care provider, you've generally immunized a large number of your patients with the older polysaccharide vaccine. So now with the new conjugate vaccine, you need to re-immunize all of your patients over age 65 with the conjugate vaccine in addition to the polysaccharide vaccine.
And the timing interval between the two?
Is about a year. It should be a year.
And if you have a new patient coming in who hasn't been vaccinated at
Right.
all, should you start with the conjugated first?
That's actually the new recommendation now, is that you really start with the conjugate and you do the polysaccharide vaccine a year later.
Okay, let's move on to shingles.
Right. So again, patients are under-immunized for the shingles vaccine, and there's confusion out there about it. Is it 50, is it 60 when patients should be vaccinated? This is a vaccine, again, that's really important. All people over age 60 should be immunized for it, even if you've had a history of shingles. I often have patients coming in saying that they've had shingles, so they're not sure that they need to be vaccinated, and they do.
And the interval between having an outbreak of shingles and then being vaccinated?
Actually, it's not well defined. Certainly, we would wait until it resolves, but as far as I know, there's no specific timing recommendation.
In Canada, the consensus is about a year to 3 years, okay. Usually about a year, 3 years, so you ride the wave of the boosted immunity. But certainly, patients come in with shingles and want to have the vaccine, and that's a no-no. Yes. Okay, human papillomavirus vaccine for midlife women.
So this is a change as well. First of all, there's, now we have several HPV vaccines out there. So we now have the 9-valent, which really is the newest vaccine. And again, that extends the coverage for which strains of HPV we're immunizing against. And again, in the United States, really recommendations are not to use HPV vaccines in midlife women. Really, the cutoff is really age 26. I'm aware that in Canada, the recommendations are a little bit different. I certainly do think in unvaccinated midlife women who are in a situation where they may be becoming exposed, that if you explain risks, benefits, and they're willing to pay out of pocket for it, that may be appropriate for them. And certainly in Canada, I'm aware that immunization is extended beyond the age 26 in the United States.
No upper limit. And for those midlife women that we see who have come to colposcopy or LEAP and have had proven diseases, is it too late to vaccinate them?
So again, there's no specific recommendations in the U.S., but I believe that you should continue to vaccinate, yes.
Thank you so much.
Thank you.